My name is Samir Laul.
My name is Madison Tyree.
My name is Ferdous.
I'm Helen, Karimi.
I'm actually a UConn alum. I graduated in 2015 with a degree in molecular and cell biology. And since I've been working in the biotech space a bit and I've been doing research.
I just graduated from UConn with a Bachelor's of Science in Psychology. Also doing research in the IBAX lab, doing semantic learning and just really understanding how you really process sentences.
I went to Wesleyan University where I got my bachelor's and master's degree, and for my bachelor's I studied neuroscience and I'm incredibly passionate about the field. And then for my master's at Wes, I did research in molecular biology.
I did my Bachelor's of Science in Behavioral Neuroscience from Michigan State, and then I decided to pursue research at the University of Michigan. And there I worked in a physiology lab where we mainly focused on studying the behavioral and metabolic measurements of glucose homeostasis.
Well, I want to find a way to really get involved in the medical community. I just found this program through UConn's career fair, and I kind of listened in about this program, and I found it super interesting about how you can have both clinical and academia kind of merged together.
I actually learned about this program, I think, from one of my neuro academic advisors. She said that I don't know, a lot of neuroscience people have kind of been recruited for jobs like these, and I didn't think initially that there was any, like, I guess, marriage between clinical and academia in a way. So I thought that this was a good way to kind of apply your basic neuroscience knowledge and neuroanatomy, and then also get that clinical experience and interaction.
So when I was finishing up my master's research, I found myself really enjoying interacting with a lot of the people that were in my lab, and so I found myself wanting to have more interactions instead of just spending time in the lab. And I found myself missing neuroscience and wanting to have more of a clinical neuroscience experience.
I actually learned about the program during the career fair in 2018. I had the opportunity to meet Dr. Andalev and was really excited about the program and just kind of the practical side as well as the didactic side. I've always been interested in neuroscience, so this was a great combination for me.
I really liked the seminar courses where we had speakers across different healthcare professions come in, talk to us about case studies and, anesthesia regimens. That's been really incredible. And I really like the nursing course I took where we learned about the different patient assessments that are carried out, so like an abdominal assessment or the head to toe.
All of the core classes were really exciting because, again, we were not only learning about the neuroanatomy, the neurophysiology, but also how we could apply practical modalities and in a way that we're actually able to record how the neurosystem is working. But I think one of the best parts was that there was such a diversity of classes.
Is honestly all the electives that you can take. There were so many opportunities to be able to dip your feet in different fields, and especially my nursing class that I've taken on campus has really shown me the other side of what we may not always see that nurses do, and then it helps me have a broader perspective.
One of the best parts has been the practical side of the program, really being in the OR and having the opportunity to work with patients directly, learning tangible skills, the different modalities, but also connecting it to the neuroscience has been just a great experience.
I feel like I'm a more effective communicator, and I feel like I have definitely gained a lot more confidence in the OR, and I've learned to make kind of game time decisions.
Yeah, I think my favorite thing has been watching anesthesiologists take care of the patient. Most of the time, as a neuromonitoring clinician, you'll wait for the patient to be intubated, and I really enjoyed watching the compassion that the anesthesiologist had toward their patient. They would hold the patient's hand and say, "You're okay, this is going to be great, you're doing great," and just like seeing how much of an effect that had on the patient has been really touching.
I think one of the memorable experiences that I've had was probably seeing an alert, like where a patient has lost some signals in their arms, and kind of seeing how the OR shifts and the dynamic that we have to work around, trying to be in the middle with the surgeon, but also communicating with the rest of the staff and seeing how we can move forward for the patient's best interest.
To know that it is challenging but rewarding. Also, you will never work a 9 to 5, so just get that in your head now. And definitely the ability to work under stress is important.
Just know that it's a big responsibility. Being in the OR can be a daunting task at first, but it is something that you're really well trained for in the program. The program mentors really guide you along the process, and I think really you will come out of it feeling like a different person, a more responsible person, and someone who is really making an impact in the world of healthcare.
I would tell them that this is an incredible field, and even if you don't know much about it now, if you end up doing this program, you'll learn so much and you'll likely fall in love with the field. And the best thing about the program is that you get to learn within the classroom and then apply it in the operating room. And in terms of getting through that, you just got to stay committed and really be passionate about patient care.
Try to dedicate yourself to this program because this is a huge responsibility. You're going in as a professional, working with all these professionals within the OR, and you really have to be present, be 100%, and continue to just give your best.